Good morning, my name is Alexandra Barker, and today I dissected a chicken wing. So this is my chicken wing, and the first thing I did was I gently took off the skin surrounding the chicken wing. Following that, I gently separated the muscle from the fascia and from the bone. And by doing this, I was then able to observe the extension and flexion, and I got to see the relationship between muscles and ligaments and in relation to these movements. I then went ahead and I cut away the ligaments and muscles from this center joint here, which we'll call the elbow joint of the chicken. And before I dive into the elbow joint, I want to state that this is the chicken humerus bone. This would be the upper portion of the limb. And the lower portion of the limb here, we have the radius and the ulna. Diving back into our joint here, we have the articular capsule, which is made up of two layers. This is what is connecting these two upper and lower limbs currently. There is an outer layer here that is made of dense connective tissue, and then we have the inner layer, which is made up of the synovial membrane. So let's see if we can get in there. So this part right here is the synovial membrane and in between. Now these white parts here, this is the articular cartilage. It's very smooth to the touch and white, and these articular cartilages cap these bones. Now inside the articular capsule and in between the cartilages, when this bone is together before I dissected it, would have been the synovial fluid. And the synovial fluid acts as a lubrication between the joints. And that is my joint dissection. Moving on to a disease that affects the joint would be psoriatic arthritis. So I work in dermatology, and we see patients with psoriasis come in quite frequently. And psoriasis presents on the skin as like a silvery, patchy, dry area. And a lot of the times it's localized on the epidermis around the elbows. However, with severe psoriasis, it can also be accompanied by psoriatic arthritis. So we'll get our psoriasis patients come in complaining of joint pain, swollen fingers, onchodystrophy, and if that's the case, then we would diagnose them with psoriatic arthritis. Now, psoriatic arthritis is a disease of the inflammation of joints, and it is an autoimmune disorder, and the pathophysiology isn't quite understood at this point, but it's strongly suggested that T cells in your immune system start attacking the synovial fluid within the joints. Now, when the synovial fluid within the joints are compromised, the synovial fluid can no longer perform the duties that synovial fluid is supposed to perform. For example, it helps with lubrication, and so when you have a lot of inflammation here, these joints start to swell, and so you can't, bend or extend and flex your joints quite as easily. The synovial fluid also provides lots of nutrients to the rest of the joint, and when it's compromised, the joint may not receive the nutrients it needs. Also, people with psoriatic arthritis, the inflammation will make the joint swell, and so then the movement of the fingers and the compressing of that swollen synovial fluid will become painful. Typically in our dermatology office, we treat our psoriasis patients with psoriatic arthritis with biologics. Two common ones that we use are Cosentyx and Enbrel, and unfortunately it's my job to do the PAs on these, and so I'm quite familiar with the biologic process. Anyways, this is the conclusion of my chicken wing dissection presentation. Thank you for listening, and I hope you have a great day.